My name is Diane and I came to Syracuse Medical as a referral through a friend because I had been suffering so much with my rheumatoid arthritis and had a great deal of pain in my shoulders and my neck, and had made so many trips to orthopedics for injections of cortisone into my shoulders and my arms and my hands. And this friend of mine referred me here because of the success he had had with decompression therapy. So I came and I met with the doctor, talked to him about the issues that I had, and he set up a plan for me. And I agreed to that plan and went ahead and started. I didn't expect really anything in the beginning. When I finally did get to about the 10th or 12th week, I began to notice that I was able to do things that weren't as painful or as difficult. And as the decompression went on and I got towards the end, I began to realize that I was sleeping better. I didn't have to sleep with a pillow under my arm to keep it level anymore. I could reach for things above my head, under a chair, without ending up with excruciating pain in my neck or in my shoulders. And I felt like I had been freed from something that was very restrictive of the normal everyday things that I like to do, but also the things I enjoyed doing, like gardening and some other craft and project activities. Once my decompression was finished, I went ahead and signed up for a maintenance program of doing decompression and also doing adjustment therapy. I have continued that, and I wouldn't have it any other way because I don't want to go backwards, nor do I want to say, hey, I'm cured, and then all of a sudden be 6 months down the road and I'm in tremendous pain while I'm doing something and having to rush in and have a fix. So for me, it has been a very, very successful thing. It's something I will continue to do pretty much forever while I try to keep my rheumatoid arthritis in check and keep the ability to have flexibility and motion and movement without a great deal of pain.
Diane, would you recommend this treatment to other people?
Absolutely. I know it's not a cheap thing to do. My insurance doesn't pay for it, but I budgeted into my my own budget. My husband and I work it out. And the thing is that I look at what I save money on. I've saved money on emergency room trips. I've saved money on pain medication. I've saved money on ice wraps, ointments, and I have been able to do a lot of things that I've had to pay other people to do because I couldn't do them before I had this therapy.
So it kind of worked out that the money you spent on this treatment, actually, you basically saved in other ways.
Yes, and also it's preventative. I mean, we do things, people do things all the time to prevent, like we maintenance our cars. We change the oil, we take care of our heating system, we change the ducts in our ductwork. We do all those things. So if this is something that I can do to maintain what I've achieved, then I don't want to lose it. I don't want to go backwards. So yes, I think that this program is very successful.